Okay, so at this video I'm going to talk about the complication of thyroidectomy or complications of thyroid surgery. Any one of the structures that surround the thyroid may be injured in a thyroid injury, like the arteries, the vessels, the nerves. Okay, the parathyroid gland also may be injured. Any one of the structures, the esophagus, the trachea, the major blood vessels, all of them may be injured, leading to complication of the thyroid surgery, which may be an early complications and late complications. Early complications just like hemorrhage, infection, and so on. Okay, so let's just get into these complications, starting from the most important, which is the nerves injury. Okay, one of the most important nerve to be injured post thyroidectomy or during thyroid surgery is the recurrent laryngeal nerve. Okay, the recurrent laryngeal nerve. You can see here the right and the left recurrent laryngeal nerve, and the most common one to be injured is the right recurrent laryngeal nerve. This is the normal right recurrent laryngeal nerve, the normal left recurrent laryngeal nerve, and this is the injured recurrent laryngeal nerve. Okay, here the continuation, it's discontinued. Okay, so how can the patient with recurrent laryngeal nerve injury present? If it is unilateral right recurrent laryngeal nerve, the patient will come to you with hoarseness of voice. Okay, if it is bilateral, the patient will come to you with dyspnea and maybe with life-threatening closure of the glottal. Okay, all these can be presented. The recurrent laryngeal nerve is not the only one to be injured in thyroid surgery. What we call the superior laryngeal nerve may be injured, okay? And also the cervical sympathetic ganglion, leading to what we call the Horner syndrome. The Horner syndrome, which is a partial ptosis and anhydrosis, okay? So all these nerves may be injured at the thyroid surgery. And actually, the most important part of the recurrent laryngeal nerve to be injured in the thyroid surgery is the farthest 2 to 3 centimeters of the recurrent laryngeal nerve. Okay, it may be injured in less than 1% of cases if the surgeon is expert, and up to 14% in non-expert surgeons. Now, the other important complication of thyroid surgery is the hypocalcemia. Okay, you know that the parathyroid gland, which is responsible for parathyroid hormone, which is related to the calcium reabsorption and so on, okay, may be injured accidentally during the surgery. Okay, so that will lead to hypocalcemia, which may be transient in about 50% of cases and permanent in about less than 1% of cases. Okay, the hypocalcemia will be presented as numbness around the mouth, periorbital numbness. Okay, here the patient will feel numbness, and what we call the Chophistic sign and the Trousseau sign. Chophistic and the Trousseau sign. Now let's see what is Chophistic sign.
Trousseau sign is a clinical sign of facial nerve hyperexcitability, also known as tetany, that is seen during times of hypocalcemia, which can result from hypoparathyroidism, pseudo-hypoparathyroidism, vitamin D deficiency, etc. When the facial nerve is stimulated due to tapping at the angle of the jaw, the ipsilateral, or same side, masseter muscle will contract. Now the practitioner will demonstrate Trousseau sign on this patient.
And the Trousseau sign?
Trousseau sign is a clinical manifestation of hypocalcemia that is more sensitive than Trousseau sign. To elicit Trousseau sign, occlude the brachial artery using a blood pressure cuff. The lack of blood flow exacerbates the existing calcium deficiency in the neuromuscular tissues of the distal arm, causing spasms of the hand and forearm muscles. This leads to wrist and metacarpal phalangeal joint flexion, proximal and distal interphalangeal joint extension, and finger adduction. As we occlude the blood vessel, Notice the patient's hand turning upward and inward, inflection and adduction.
Okay, postoperative hypocalcemia actually is more likely in patients undergo concomitant thyroidectomy with central lateral neck dissection, okay, in patients with Graves' disease and so on, okay. Now, other complications may happen after the thyroid surgery, which is the hemorrhage, okay, bleeding as a complication. And most of the cases, we don't have to do an emergent reabsorption of and evacuation of the hematoma, okay. But if we have some airway compromises, okay, that will require, of course, reintubation and tracheostomy, okay. We have other infrequent complications of thyroid surgery, just like seromas, okay, which must be aspirated, wound cellulitis, okay, infection, and injury to the surrounding structures, as I told you at the beginning, just like the carotid artery, the jugular vein, and the esophagus. The carotid artery, the jugular vein, and the esophagus, which is infrequent. So these are the post-thyroidectomy complications: the nerves injury, recurrent laryngeal, superior laryngeal, cervical ganglion, and the hypocalcemia, permanent and temporal, okay. So, and the bleeding, the hematoma, the cellulitis, the injury to the jugular, esophagus, and carotid vein. Okay, that's all for this video. See you in another video. Thank you.